I'm Dr. Sri Nagesh, a plastic surgeon working at Ojas Aesthetic, Madhapur, Hyderabad. Today we shall discuss about both the surgical and non-surgical options for treating lipedema. Treatment of lipedema requires a multifaceted approach that includes both surgical and non-surgical options. There is no one single treatment for lipedema which makes treatment of lipedema quite challenging. The goal of the treatment is to manage symptoms, prevent the disease progression, that is, either by slowing down the progression or arresting the progression if it's possible, and improve the patient's quality of life. So, what are the available options for treating lipedema? First, we shall discuss about the non-surgical options, then we shall go on to the surgical options. Because the non-surgical options are almost always preferred over surgical options. And for your information, the non-surgical options have to be continued or may have to be continued even after you consider surgical options, for varying periods of time. So, coming to the non-surgical approaches, so the non-surgical approach is typically the first line treatment and focuses basically on symptom management, attempting to improving mobility and enhancing the overall well-being. These non-surgical options do not eliminate the abnormal fat tissue, but can significantly sometimes reduce the associated symptoms like pain and swelling, which is why non-surgical options have a role in the treatment of lipedema. So, what are the non-surgical options? One is compression therapy. They're not very complicated. It's a compression therapy. And what is compression therapy? It is the wearing of compression garments like stockings, leggings, tight socks, as many people wear them for varicose veins. Stockings for varicose veins. Similar type of leggings or stockings to support the lymphatic flow and reduce swelling. What are the benefits now of this compression garments? It reduces pain and heaviness in the affected areas. It improves lymphatic drainage. So, what are the disadvantages of this particular condition, this particular treatment option? This requires a proper fitting and fitment. So, a proper fitting stockings or garments are very essential, and you need to use them consistently for the maximum benefit. And most of the people do not use it consistently. They just use it once in a while, as and when they have a particular issue, or when they remember, that they have stockings which they need to wear, they wear it. So if you are going to do that that way, it is not going to benefit you well. The next is manual lymphatic drainage. Manual lymphatic drainage is a specialized type of a massage therapy designed to stimulate the lymphatic system and encourage the fluid movement from the distalmost part of the body, the farthest most part of the body, back into the circulation, so that the swelling is reduced and the limb becomes lighter. So, what are the benefits? It relieves swelling and discomfort. It helps in prevention of secondary lymphedema. That is, secondary lymphedema is, there are two types of lymphedema, primary lymphedema and secondary lymphedema. The secondary lymphedema is resistant lymphedema. It does not respond well to any treatment. So, once fibrosis sets in, it becomes very difficult. So, to prevent that, if you do go in with this manual lymphatic drainage, it helps to a great extent. So, what are the disadvantages? The disadvantages is it requires regular sessions frequently, and it often has to be performed by a trained therapist who knows how to do and handle the lymphatic massages, the drainage therapy, usually by a physiotherapist or an occupational therapist. Next comes exercise and movement. This is primarily a low impact activities such as swimming, walking, yoga, or water aerobics. Lifting weights and other things is not a bad option, but should be considered according to the stamina and the ability of the individual, and associated problems. Some of these patients have a condition similar to Ehlers-Danlos syndrome, where there is a hypermobile joints and hyperflexible flexibility of the body. These people, when they start to lift weights without supervision, may dislocate their joints or subluxate the joints, which add to further complications. So you have to be careful about that while you're doing these things. So what are the benefits of exercises? It promotes lymphatic flow and joint mobility, and it reduces stiffness and improves the overall fitness of the individual. So like I already did mention something about the disadvantages. So high impact exercises may exacerbate pain, may increase the pain. So you should always, if you're doing high impact exercises or high intensity exercises, you should do it with caution or do it under supervision so that you get the maximum benefit. Next is diet and nutrition. So a proper anti-inflammatory diet with low processed carbohydrates, primarily high fat, low carbohydrate diet with a lot of antioxidants. Like for example, a keto diet or a Mediterranean diet, a paleo diet, these kind of diets, they help in reducing inflammation and managing overall body weight. Though it does not directly reduce lipedema fat. The normal fat can reduce, but lipedema fat generally does not reduce. It is resistant to diet, exercise, or even this lymphatic drainage and other treatments. So these diet and exercise should be tailored to individual needs. So next comes the compression devices, pneumatic compression devices. It is application of this particular device. It's like a sleeve that you wear it, which is attached to a machine which sends a pressurized air into each chamber, thereby stimulating lymphatic flow. So the benefits is it can complement manual therapies, like those people who are going for MLDs, like manual lymphatic drainage and other such things. So where the therapist they need to take the help of a therapist. So that can be a sort of it can accentuate or improve the condition further. And other thing is, if you have this particular compression device at home, it is convenient to use it at home itself. So what are the disadvantages? It may require a healthcare provider's guidance, and it may not be suitable for everyone. For example, those people in stage 3 or stage 4 may not find a proper fitting compression sleeve, which can be wrapped around and be used effectively. Next is psychological support. So this is a therapy or a counseling to address emotional and psychological impacts of living with lipedema. The benefits are it improves mental health, body image, and coping strategies. But the disadvantage is you need to find a group of individuals who are willing to come together, who have lipedema and are still want to come together and work with each other and help one another to benefit out of it. So with all the non-surgical options at hand, now let us look at what are the surgical options and why is the surgical options for treating lipedema. Now, what does the surgical interventions do? So surgical interventions Their aim is to remove the abnormal fat deposits, improve contour, and reduce or remove the symptoms which are accompanying lipedema. So these should be considered when non-surgical treatments are not sufficient to treat the condition or this or despite non-surgical methods being followed, the disease is impacting the quality of life of the individual. So what are the surgical options available? The surgical options are lipedema excision in the form of a lymph-sparing liposuction. Why lymph-sparing liposuction? Because there's a weakness of the lymphatic system and you need to protect the lymphatic system as far as we can while we do this particular procedure. So it's a specialized form of liposuction designed to remove the lipedema fat while preserving the lymphatic vessels. So what are the techniques used? The techniques are either a tumescent liposuction or the best of all is the water-assisted liposuction with as far as my experience goes and some of my mentors, and of course the power-assisted liposuction. What are the benefits of this particular procedure, liposuction? It reduces pain, heaviness, and mobility limitations. It also improves the body contour and you can try to achieve symmetry to a great extent. And removal of the lipedema fat may also slow down the progression of this disease, thereby giving relief to the affected persons for a variable length of time. So what are the limitations of this particular procedure? You need a surgeon who is skilled in this particular process and also who understands what lipedema is. You can treat lipedema. Another problem is it requires more often than not multiple sessions depending on the severity of the disease, the stage of the disease, and the volume of fat that is there in the body. And post-surgical compression therapy is very crucial for early recovery of the patient. Next comes excisional surgery. What is this excisional surgery? This is removal of the excess volume of skin and fat and is often combined with liposuction in advanced cases with significant skin laxity or multiple skin folds. What are the benefits? It improves the function and reduces the skin-related issues like fungal infection, chafing of the skin, burning sensations, and intertrigo. So what are the limitations? The limitations are it is more invasive than the liposuction. It may require a little longer recovery time. It is usually not the first chosen option. And when you choose, what are the factors that you have to consider when you choose this particular kind of an excisional surgery? The stage of the lipedema. So in more advanced stages, the surgical intervention may become mandatory or more beneficial for these people, especially severe mobility, pain issues, psychological distress, and all these conditions may actually lead you towards this particular treatment. So the overall medical conditions like lymphedema, cardiovascular disease, diabetes may also affect and influence the treatment choices. So what are the goals and expectations in this particular thing? The non-surgical treatments focuses on symptom management. And while surgery not only improves symptoms, but also improves the appearance and brings about the realistic expectations in the affected individual. So you need to have access to specialized care. So it often requires a collaboration between specialists, including vascular surgeons, dermatologists, physiotherapists, and dietitians. What is the role of vascular surgeons in lipedema? The role of vascular surgeons in lipedema is because there is a weakness of the lymphatic system, there is a weakness of the venous system. So these patients can tend to progress towards lymphedema and also progress to varicosities, varicose veins. So these conditions are generally treated by vascular surgeons. Dermatologists, because there are we are dealing primarily with skin, which keeps on getting stretched and forms multiple folds as the disease progresses. So these areas can lead to pruritus, fungal infection, and other skin diseases, associated skin diseases, which also need to be understood and treated accordingly. Physical therapists, physiotherapists, and dietitians, we already discussed earlier. So you need an integrated approach to the treatment of lipedema, which is a combination of both surgical and non-surgical treatments. So before surgery, you need to focus on non-surgical methods to reduce inflammation, reduce swelling, and reduce the risks involved while doing surgery. So after surgery, what you need is you need to continue with compression therapy, manual lymphatic drainage, and exercise to maintain result and prevent recurrence of the disease or progression of the disease. So treating lipedema requires a personalized and a holistic approach, while non-surgical symptoms provide significant relief. Surgical interventions, lymph-sparing liposuction offer a more definitive improvements for those with advanced disease. So a collaborative approach and ensures the best possible outcomes. Thank you. If you have any queries, you can feel free to log into www.ojasaesthetic.com or www.lipedema.in or approach us at Ojas Aesthetic, Madhapur, Hyderabad. And you can also contact us on 95151 06591 for more information. Thank you.